Hello, and welcome to another live broadcast with MedStar Health. My name is Amy Cameron, and I'm joined today by some of our experts from the MedStar Health Wound Healing Institute with locations in Washington, D.C. and Baltimore. We're here to bring awareness about saving limbs during Limb Loss and Limb Differences Awareness Month. This impressive group will discuss why wounds don't heal, our team approach to saving limbs, the latest treatments, and more. So if you have a wound that won't heal in your foot or leg, keep watching to learn about the importance of seeking care right away. And if you have any questions for our experts, share them with us in the comments and tune in for their responses. Let's meet today's guests. We have Dr. Jason Atves. He's a podiatric surgeon at MedStar Georgetown University Hospital. He manages all forms of foot and ankle pain, injuries, and deformities to complex limb reconstruction. He specializes in foot and ankle reconstruction and other specialized procedures. Thanks, Dr. Atves, for joining us.
Thanks
We
for
also
having
have,
me.
thank you. We also have Dr. Karen Evans, a professor of plastic surgery at MedStar Georgetown University Hospital. She is also associate program director for the plastic surgery residency, and her primary interests are microsurgery and flap reconstructions. Welcome.
Thank you.
Next is Dr. Jonathan Furmanek, is also a podiatric surgeon at MedStar Franklin Square Medical Center and MedStar Harbor Hospital in Baltimore. He specializes in limb salvage, lower extremity injuries, ankle arthritis, and fracture care, minimally invasive surgery, regenerative medicine, wound care, and more. Thanks, Dr. Furmanek, for joining us.
Great to be here.
And Dr. Richard Yoon, a reconstructive plastic surgeon at MedStar Georgetown University Hospital. He specializes in the management and reconstruction of wounds of the scalp, back, abdomen, and lower extremities, with special interest in limb salvage and microsurgery. Thanks, Dr. Yoon, for joining us.
Thanks for having us.
And lastly, we have Dr. Cameron Akbari, who wasn't able to join us because he's in emergency surgery right now, but hopefully he'll be able to join later. But he is a vascular surgeon at MedStar Georgetown University Hospital, and throughout his 27-year career as an attending vascular surgeon, his clinical and research interests have included complex lower extremity, arterial surgery, and endovascular interventions, and diabetic limb salvage. He continues to perform numerous other procedures, including aortic, carotid, and dialysis access surgery. Sorry. So hopefully Dr. Akbari will be able to join us later. Welcome to our guests, and let's get started with some questions. Dr. Atves, we mentioned the term non-healing wound. Can you tell us why wounds often don't heal and who is at risk?
Yeah, thanks, Amy. That's a great question, and to be honest with you, it's an elusive question and answer. I think in the general public and perhaps even in general medical clinics. But almost anybody is at risk for a non-healing wound, or what we kind of often refer to as a complex wound. And effectively, it's a wound that just does not respond to the normal, regular, or routine wound care interventions, regardless of where a wound might occur. A wound in a normal, healthy individual should be able to heal within about a few weeks, or even just a couple of months at most. But certainly more often and much more disadvantaged are the patient populations with comorbidities, and diabetes is a great example of that. That just places these patients at an increased risk for experiencing wounds that just don't heal. And that could be for an assortment of reasons, from because of diabetes, because of poor blood flow, because of mechanical reasons that exist within their lower extremities or their body in general. So when it all comes down to it, a huge patient population that can experience these types of things, but certainly those people who are already comorbid or disadvantaged are at an exponential elevated risk for those types of things.
Oh, wow. Can you define limb loss?
Yeah, that's another great question as well. And depending on who you ask, you might get a few different answers for it. Some individuals say that losing purely just a small toe is limb loss. Other individuals may say, well, losing the entirety of the foot and the ankle, what we refer to as a below knee amputation, may be limb loss. So it is all really kind of a matter of perspective, whether that's from our perspective or from a patient's perspective. But I think perhaps even more important than identifying whether you've lost a limb or you preserve or salvaging a limb is how impactful it is on the individual and how impactful it is on the patient. Because there are plenty of individuals that have a loss of just purely a small baby fifth toe, and it's extraordinarily impactful on their life and their way to gain income or just live their life in general. And then there's plenty of people who, for fortunate or unfortunate reasons, go on to a below the knee amputation and make a pretty smooth transition to those types of things. So all in all, it's really kind of taken in context.
Mhm. Why would someone need limb salvage surgery?
Yeah, that really kind of brings these all these themes together. Limb salvage is basically our team's primary focus, because we know that individuals, and this is making a gross statement about the general population, but we know that when people lose portions of their body, and the lower extremity is a great example of that, that it can be quite impactful on their ability to ambulate, to walk, to get around from point A to point B, again, to make a living, to interact with the world on multiple levels. So when it comes down to limb salvage, our primary focus is not necessarily preserving their limb or preserving portions of their body, but more so maintaining their function. And that becomes extraordinarily important and impactful when we're dealing with people who have complex or these non-healing or chronic wounds, because unfortunately bacteria never sleep, and we're at a constant battle with bacteria, basically to eradicate bacteria so that we can expect that people would do well, regardless of kind of their final level of either limb loss or limb preservation.
Great, thank you. Dr. Evans, I have a couple questions for you. Could you tell us the team approach to wound care? Tell us about the team approach to wound care and limb salvage at MedStar Health Wound Healing Institute.
Yeah, I mean, the team approach is really the most important factor for our success. We work, we work as a group on pretty much every single patient. The patients that we see at Georgetown and also other MedStar sites are incredibly complex. They're usually patients that have tried, multiple different options. They may have seen, an outside community practice for wound care. And then they finally kind of made it to our tertiary center. And so these patients are very, very complex. The team that is critical, the critical elements for a team include podiatric or orthopedic surgery, especially for the lower extremity, since we're focusing on that, vascular surgery, plastic surgery, infectious disease, to look at the, antibiotics and the presence of infection. We also have internal medicine doctors that help us through any hospitalization that's required for a patient that needs surgery. Diabetes management is obviously critical for any kind of healing. And we also have dermatology as well as rheumatology. For about 20 to 30% of the wounds that we see, they're kind of classified as atypical, or wounds that are related to autoimmune states that require dermatology and rheumatology. In addition, one of the Georgetown principles that is really MedStar right is, treatment of the whole patient, and cura personalis, means, head to toe treatment, which also means psychiatry. And so we've been lucky to and fortunate to work with our psychiatric, and behavioral health colleagues as well in the wound center. And it's been a kind of a newer added approach to our team. And we found that to be incredibly helpful, especially patients that are facing limb loss. That being said, wounds that are complex of the lower extremity, number one, the biomechanics of the foot have to be corrected. Otherwise, the wound will just come back. And that's where orthopedic and podiatric surgery come into play to rebuild the architecture of the foot so that that area isn't breaking down over and over again. Number two, the vascular surgery team, like I mentioned, if you don't have blood flow to the extremity, there's nothing you can do. I mean, it will never heal. It doesn't matter what you put on there, shark skin, pig skin, your own skin, without blood flow, nothing will heal. And then number three, like I said, plastic surgeons can help with the final layer, which is how to rebuild the soft tissue envelope, how to rebuild the skin, the muscle, the fascia, and get to something that can be functional. one of the most important things that we do as a group is looking at the patient in terms of their function. So we talked about the head to toe treatment of someone. So how are you, what everyone's goal is different. And so with the team approach, we can all come together and look at the patient as a whole and as an individual unique patient to say, what are your goals? What is this wound doing that's inhibiting your ability to work, to travel, to function? And so all of us kind of come together to help that patient get back to their function. And so we really, really focus on the function being number one for our approach. But without the team and the critical elements, it's really, really hard to be successful for these kind of patients.
That's fantastic. Can you explain what conditions can occur when blood flow is disrupted? How can that cause a patient to be at risk for losing a foot or leg?
Yeah, so peripheral vascular disease or peripheral arterial disease, PVD, PAD, described, differently. It's the same problem. So the arterial supply, starts in your heart, goes down into your groin, and all the way down into your foot. And so the end result of, your heartbeat is the blood rushing down into your foot. So when those arteries are diseased, usually due to diabetes that causes plaques inside of your arteries. Either diabetes or smoking can also cause, peripheral arterial disease. And also kind of having high blood pressure for long periods of time, hypercholesterolemia, these predispose to having blood flow problems. So when the blood is not getting to the extremity, a lot of times you can, patients start out with some pain with ambulation, and they, can be called claudication. And that can progress to what's called rest pain when you get out of, bed in the morning, maybe your foot is feeling cold, it can be painful. And then it can also progress to wounds. And so peripheral vascular disease related, wounds can lead to the need for, bypass type procedures and endovascular procedures. So these are procedures that our vascular surgeon does to promote the blood flow and to promote, healing.
That's great. How can patients prevent vascular conditions that can put them at risk for limb loss?
Yeah, that's a great question. I mean, I think, we focus so much on the end stage, right? Which is sometimes, end stage disease of your skin can occur, which means that the wounds have occurred on your skin. And similarly for peripheral arterial disease, sometimes we focus so much on the end stage that I think, prevention is key. And so especially for vascular disease, keeping your blood sugars under in well controlled is critical to prevent calcifications and prevent peripheral arterial disease. Keeping your blood pressure under, in a normal state is also very important because high blood pressure can lead to peripheral vascular disease. I also mentioned that cholesterol is very, very important. And probably one of the most important ways to prevent vascular disease is exercise. And so, being active, using your phone for steps so you can watch your steps throughout the day, making sure, you're standing and walking and doing those little things throughout your life make a big difference in the end. I think it's also important when you're kind of thinking about wound care and vascular disease is to think about patients that are on dialysis. So any patient that is at risk for dialysis or kidney problems also has a very, very high risk of peripheral arterial disease. And so that population, we really recommend that, we have them involved in vascular surgery early so that they can be screened and have some screening done, which usually is a clinic visit, sometimes an ultrasound or even just a small Doppler probe. And we use that, Dr. Furmanek, Dr. Atvez, Dr. Yoon, all of us use a Doppler, exam pretty much on every patient that comes into the clinic, and we can listen to their blood flow. And, if we see that it's abnormal, if we feel like the sound isn't, loud enough and we can kind of hear the different flow waveforms, then we would immediately have our vascular team take a look with either an ultrasound or what's called an arteriogram which is, an outpatient procedure where patients get, some sedation, and then they undergo a small needle is placed in the artery and some dye is put into the vessels, and those light up so that we can see where the disease is. And then Dr. Akbari and his team can do balloon angioplasties or open up those blood vessels, to allow for the flow.
Oh, that's great. So there are lots of options. At this time, I want to pause and welcome our viewers again, those that have just joined us. If you're just now tuning in, we're here with our experts from the MedStar Health Wound Healing Institute. We're raising awareness about saving limbs during Limb Loss and Limb Differences Awareness Month. And if you have any questions for our experts, share them in the comments below. We can get back into some questions for Dr. Furmanek. What is your role as a podiatric surgeon in limb salvage surgery?
Yeah, that's a great question. So Dr. Atbez and I, as podiatrists, are one link in the chain of the limb salvage team here. And we provide both conservative prophylactic type treatments as well as surgical treatments. And as Dr. Evans elegantly put earlier, we can help rebuild the architecture of the lower extremity. And part of the training and education of a podiatrist is a strong emphasis on the biomechanics of the lower extremity. And I think this is a major key part in the care of these patients, because typically biomechanical abnormalities often precede the wound development. And so prophylactic care or acute surgical intervention can translate to preservation of a functional limb.
Thank you. What is recovery like for patients after limb salvage surgery?
Well, each patient and situation is unique, but the goal is always really the same, and that's early rehabilitation with an emphasis to safely get back to normal activity as soon as possible. And many times patients can return to normal activity within a few short weeks. But again, each patient and situation is very unique.
Mm-hmm. How soon can someone walk with a prosthetic leg or foot after surgery?
Yeah, that question kind of stems a little bit off the last one. And again, the goal is always to allow the patient to safely resume normal activity as soon as possible. And again, each situation is unique, and it can range from a few short weeks to several weeks.
Okay. Dr. Yoon, are there multiple procedures that patients need after limb salvage surgery? Oh, you're on mute.
Sorry. Yeah, like Dr. Furmanek said, and everyone else before me was saying, it really is patient specific. Now, if you look at the long kind of continuum of how we manage these patients, there's definitely multiple procedures before and after limb salvage surgery, especially since these patients have chronic, complex wounds that, for our goal, is first to get to clean cultures, meaning there's no bacteria there, reconstructing the architecture, like Dr. Furmanek said, and then also making sure that the blood flow is good, and then ultimately the soft tissue envelope is reconstructed. So before the final limb salvage procedure, these things have to happen. And then afterwards, we're monitoring these patients long term. Obviously, a lot of these patients are complex and have comorbid conditions that are chronic. And you can also develop another wound after these procedures. So we want to make sure that we're treating them throughout the rest of their functional term. So, there could be flaps that we do that need a little bit more retooling so that they can fit into a shoe better. Make sure that the foot is more functional for ambulation, doing some sort of tendon transfer. So there are a lot of procedures that can happen before and after limb salvage surgery.
Okay. Could you tell us how plastic surgeons help prevent limb loss?
Yeah, so like Dr. Evans mentioned, some of the obvious things that we do is we focus on the soft tissue. So we have many techniques and tools for us to do that, starting simply with getting the skin closed primarily, which is just bringing the tissue together. Otherwise, we can do skin grafts, and then we also do more complex things like local flaps or even free flaps, which is what microsurgery is, which means we take tissue from different parts of your body that are disconnected from their blood supply and reconnecting it down to where the wound is using a microscope. So those are some of the things that plastic surgeons do. We also focus on nerves. So a lot of times when there's amputations or wounds, there's nerves that are disrupted, and that can lead to the formation of painful neuromas, phantom limb pain. So we've developed techniques that can help with that as well. And lastly, lymphedema is a major condition that patients deal with, especially with the lower extremity. And we have techniques to help with the decreasing lymphedema in the patient. So, plastic surgeons are kind of the soft tissue experts, and that's where we're focused.
How do you make decisions about which procedures are best for each patient?
Yeah, so I think my colleagues before have mentioned this, but the team approach, right? So every day we're actually discussing all the patients as a team on a call and going through all the options and all the possible pitfalls or risks that these patients may incur with any sort of procedure. And only after those discussions every day, and then we also have weekly formal meetings where we present a complex case and we run through every single possibility that we can do for the management of these patients. And so using those meetings and that team approach, that's typically how we make the decisions for these complex wounds.
That's great. I'm going to pause because we do have an audience question from Roz. He says, my sister had an infection in her leg as a child, like 6 years old. It healed. She got COVID at 45 years old, and the site has now become infected. She's tried all sorts of things, but the wound is not healing. Have you seen any increase in osteomyelitis due to COVID?
That's a very, very good question. I'm not aware of data that would link osteomyelitis and COVID. That being said, there was clear data that COVID led to what's called hypercoagulability, which means that patients, especially early on in the pandemic, had a much higher risk of blood clots. And you might have read about that in the news, that patients were getting blood clots and were getting put on blood thinners. So that would be something to consider for your sister, would be make sure that she sees, her primary care doctor, screening for blood clots, screening for, the arterial or the venous disease. So when we talk about blood clots, we're talking about the venous system, which is different than the arterial system that we were talking about before for wound healing. But blood clots in the venous system can lead to infections and swelling in the leg. But I would say that if your sister had, infection and wound at age 6 and now it's coming back, that sounds very much typical for an osteomyelitis scenario in the bone. And that probably should be seen, sooner rather than later. We wouldn't want the bacteria to spread. So, I would say see, any one of us, like either orthopedic surgeon, or, plastic surgeon, at least to start with getting some x-rays and look at that leg. I don't know if you, Dr. Yoon or Furmanek, had any other comments about that.
Yeah, I agree. There's a lot of kind of anecdotal data regarding COVID and in terms of long COVID and what Dr. Evans just mentioned. I don't think there's clear-cut data yet, so anything's possible. They're talking about reservoirs of COVID within the body, which possibly the bone might be one of them. But the main thing to do is, like Dr. Evans mentioned, get imaging. If it's osteomyelitis, you may need a bone biopsy or some sort of culture tissue of the bone to make that call. But seeing a provider sooner than later would be good.
That's
I would
great.
echo all of that.
Okay, that was our only audience question so far. So keep them coming if you have them. The next question I have is, how can blood sugar affect healing?
Yeah, that's the best question of all, because as I said before, I think, maintaining adequate blood sugars is one of the most important things that you can do if you have a wound, if you have vascular disease. It is the most important thing you can do. And sometimes we'll have patients in clinic that we've been following for a long time, and suddenly they get on the right, regimen with their insulin or other drugs, or their diet is better controlled. And then what we'll see is, their wound magically heals, and we take credit for it, but it's actually just the fact that they, had their blood sugar well controlled. But when the blood sugar is not well controlled, and I see Dr. Akbari just joined us. Thank you so much. I know you were in emergency surgery, but thank you so much. And we were just talking about how the high blood sugars can lead to, arterial disease, can also lead to, poor wound healing. I think when your blood sugars are high, it's called glycosylation. So the blood sugars actually kind of unite with some of the proteins in your body and make your immune system and all the other cells not as functional. So keeping those your blood glucose levels in your blood low, that will allow the proteins in your body and the immune system to function at a more normal state. I don't know if you had comments on that, Dr. Akbari, since you just jumped on.
Yeah, I think and again, it goes back, and I'm sure this was addressed earlier, it goes back to the idea of we have to take care of everything in the patient. Obviously, if we have, in my case, if I have a blood vessel which I've now opened, and yet the patient's overall diabetic care is not optimal because of poor blood sugar control, then we really haven't made any gains, So I think that's part of how, when we work together, we look at everything all together: the blood sugars, the wound healing, the blood vessels, cardiovascular optimization, making sure the patient is on the correct medications for not just their immediate problem, but for their long-term health, of which the glucose control is so important.
Yeah, that I would definitely stress. That's why the team approach is so important. A lot of the times, these patients have habituated to a high level of blood sugar, and we acutely drop them in the hospital, and they just feel awful, and oftentimes relapse very quickly after they leave the hospital. So that's why it's important to work with diabetes educators and endocrinologists to safely lower it and give them small goals to achieve afterwards.
That's great information. Dr. Akbari, welcome. Thank you so much for joining us.
Thank you.
A question for you: does smoking affect how wounds heal?
Absolutely. Again, it's smoking, we know, affects, obviously, from a blood vessel standpoint, obviously affects the macrovasculature in terms of progression of atherosclerosis. But we know that there are hundreds of compounds in cigarette smoke, as well as in marijuana as well. And one of the effects is constricting the blood vessels, making the blood vessels tighter. And at the level of the wound, at the microvasculature, that happens. And so as a result of that, we may see poor wound healing because of poor blood flow, because of that constrictive effect. Not to mention the fact that it's going to affect the oxygen carrying capacity. And again, if it is going to affect the entire patient, it's obviously going to affect the wound.
I think what also is important to recognize is that some of our patients will recognize that smoking is a problem for their particular wound, but once that wound is healed, they may go back and smoke again. But that in itself can also break down the wound that was treated and healed. If we made any surgical incisions, that can also break apart later down the line. So it needs to be the discussion that if you commit to smoking cessation, that it's more of a lifetime thing and not just an acute thing to manage that particular wound.
I think in some ways there's also, if you will, an indirect, almost a Hawthorn effect, in the sense that if a patient is meticulous about taking care of the blood sugars, meticulous about not smoking, meticulous about taking their medications on time, then they're obviously going to be more meticulous and aware of not just the wound that they have, but prevention of wound complications. They're going to be that much more aware of their overall health, of which the wound and the foot care is part of it. So it's this attention to your overall health that I think emphasizes our approach to preventing these wounds from recurring again after we get them to heal.
Mhm. We do have one more audience question from Latarsha. What kind of test should we ask our doctor to take for blood loss in order to prevent limb loss?
Sorry, can you repeat that one more time for a blood loss?
Said, what kind of test should we ask our doctor to take for blood loss in order to prevent limb loss?
I'm not sure what they're getting. A couple things come to mind. Anemia, which means that you have low blood counts, is something that, is very important to understand. And we do see that a lot of patients that have chronic wounds, chronic kind of conditions. It's actually called anemia of chronic disease, which means that your blood cells are not they're not coming back as normal if you have some blood loss. And so seeing your doctor to look at what's called, if you are trying to figure out like blood loss, you would order what's called a CBC and look at your hemoglobin level and your hematocrit level. I'm not sure if that's what the caller is talking about. But I think that one thing that we look at a lot is whether or not the blood counts are high enough to undergo surgery. And we sometimes need to do blood transfusions in patients that are amenable or that need a blood transfusion. We would go ahead and do that prior to surgery to make sure that they have enough blood volume to undergo, surgeries. That being said, none of these surgeries that we do are very highly at risk for blood loss. Some things like maybe open cardiac bypass surgery or other surgeries, that you might be talking to your surgeon about, blood loss being a big issue. But for, the surgeries that we're talking about, we don't really focus too much on that. I don't know if anyone else on the panel had any comments.
Yeah, I agree. I think, obviously we are aware of what the blood counts are. Anemia can affect wound healing. So we make sure the patient is optimized before surgery, as Dr. Evans said. But these surgeries, which are really designed to help facilitate wound healing at the local wound level, are not associated with major blood loss. But insofar as what the participant asks, insofar as blood loss, what can we do about it? We check for it. We make sure that the patient is not anemic. We correct anemia if it's judged to be of a significant level.
Thank you for that. One last question for Dr. Akbari, since you joined a little bit late. Could you discuss your role as a vascular surgeon in limb salvage care?
Sure. I think one thing we've learned is that we need to have the right environment for wound healing. And so we talk about infection needs to be controlled, offloading, preventing pressure over and over on the wound. And finally, to have blood flow for healing. Everything in the body depends on blood flow for healing. It's what makes us alive, is that circulation of blood, of having enough blood to the wound, to the tissue. And so unfortunately, because diabetes affects the blood vessels and causes hardening of the arteries, atherosclerosis, unfortunately, many of these patients are afflicted with vascular disease. And so my job then becomes to make sure that we have maximal blood flow for healing. We don't need to guess, oh, it's probably good enough or maybe good enough. We have to be 100% certain, because one thing we've learned over the years is that without adequate blood flow, the wound will not heal. So because of that, it falls upon all of us to ensure that the blood flow is optimized as best as we can.
That's great. That was all of my questions, but before we close out our discussion today, do you guys have any final thoughts that you want our audience to walk away with? Let's start with Dr. Atvez.
No, thank you. This is a great platform, and honestly, I think this is a great example of probably what's most needed for this type of patient population is education and understanding that not only are these things that can significantly afflict almost anyone, but especially the patients who are disadvantaged or who have major comorbidities. As well as just understanding that there are institutions, there are individuals, there are groups such as ourselves that are out there that can really provide a substantial amount of help to really get your life back. I would say that's probably the most glaring, basically thing that's needed for this type of patient population.
That's great. Dr. Evans?
Yeah, no, I think the title is, of our panel, and this Facebook Live is, saving limbs and improving lives. And I think that was, that captures really what we all are here and what we do every single day. And I think the most important thing to remember is every single patient is different. Every single patient's journey is different. Which makes it kind of fun for us, to be honest with you, because we partner with the patients and talk through, their life story, and we all become very, very close. And that makes it fun. And we sometimes, have to talk about amputation. And when we do that, it's really critical that we have a very good understanding of what this patient will function like, with even a prosthesis, which can be very, very functional. And so as we go through the ideas of, very complex plastic surgery that we can offer, which, as Dr. Yoon said, moving, skin or muscle along with their artery and vein to reconstruct, a big wound, it's really exciting and very, very useful surgery for these patients, like a free flap is what we call it. As much as we want to talk about that in certain patients, other patients may not be candidates for that. And so we do need to think about, their life and how to get them as functional as possible. So I think, closing, the remarks would be the idea that, every patient is unique, their goals are unique, and our job is to understand where they're coming from and where they're trying to go along their journey. And working together as a team is really the only way to do that. So, thank you so much for hosting it. And this has been really fun.
And if I could just add in closing that, we're not a team. And I think, with that idea of what Dr. Evans and what Dr. Atvez just said, it is healing wounds and improving lives. And every single patient that comes in, it's not just a team. We're an army. You have an army in front of you and behind you, because from our medical assistants to our nurses to our x-ray technologists to all of us as physician and caregivers, we really want to improve the life of our patient. And that involves healing the wound, but more importantly, we get to know these patients over months, years, decades even. And that army is always behind them, with them 365, 24/7. We're always just one step away, one phone call away from coming in and seeing us if you have a problem.
That's amazing. That's very comforting, I'm sure, for a patient.
And
Dr. Furman.
Sorry.
Oh, sorry. Go ahead, Dr. Yoon.
Just to add to Dr. Akbari's comments, I think the advantage of being at MedStar is that we have all these experts consolidated in one area, and where access to them is immediate. I can call Dr. Akbari in a second and he'll answer the phone. I can call Dr. Atvez and Dr. Furman, and it's very easy to get everyone together in a room to discuss patients. So the care happens quickly. So you're not delaying, you're not going from one institute to the other. And that's what makes this place great to work at, and to have colleagues and experts here. And we're also, pushing the research in this field and making sure that we can advance the field further. So it's a great place to be and a great place to work.
That's fantastic.
Yeah, I would echo everything that was said earlier. The team approach is unparalleled, and I think something that we do really, really well here that adds to our great success is that all of our patients are part of that decision-making process and are highly involved with that. And I think that's what also helps with our great success that we've had.
Thank you. Well, that wraps up our Facebook Live. Thanks again to our experts for your time and expertise. We know that you're very busy. And thanks to our viewers for joining us. We've had a great discussion today about wound care and limb preservation. For more information, visit medstarhealth.org/wound healing to learn more about the MedStar Health Wound Healing Institute. And to request an appointment, call the MedStar Health Wound Healing Institute. And we'll add these phone numbers and links in the comments for easy access. Thank you again.
Thank you.
Thank you.